this meeting is being held remotely and also in person and will be filmed and recorded for live and subsequent broadcasts available through the Council's website. The Council is a data controller under the General Data Protection Regulations and the Data Protection Act 2018. We broadcast and record Council meetings to fulfil our public task obligation to enable members of the public to observe the democratic process. Data collected during the process will be retained in accordance with Council published policies available through the Council's website. Members of the Council are reminded that they should follow the established meeting protocols, including around the use of the chat facility, and that comments made in the chat facility are visible to all participants in the meeting, which may include members of the public who have also received invites to the meeting. Thanks for listening to that. So I'm going to hand over to Diane for item number 1.
We have an apology from Councillor Law. We will now move to a roll call before asking for declarations of interest. And the following members please indicate if they're present at the meeting either in person or remotely. Councillor Armstrong.
Present in the chamber.
Councillor Brennan.
Present in the chamber.
Councillor Brooks.
In chamber.
Councillor Cassidy.
Present remotely.
Councillor Daisley.
Present remotely.
Councillor Hellier.
Present remotely.
Councillor Jackson.
Present in the chamber.
Councillor McCabe.
Present in the chamber.
Robert Mackenzie.
Present remotely.
And Councillor Robertson.
Present remotely.
Are there any declarations of interest?
No. Okay. Thanks very much. Everybody's very welcome, either online or in person. So I'm going to hand over to Craig Given to talk us through item number 2. Craig's joining us online, and that's the Revenue and Capital Budget Report. Thanks, Craig.
Thank you very much. Through yourself, convener. This is a standard finance paper we bring forward in a panel cycle, and this covers a number of main areas. This covers our period 9 projected 24-25 outturn position and our current capital and reserves position. As at period 9, we're currently projecting an overspend of £111,000 in the social care budget. This is a £464,000 reduction from the period 7. There are a number of over and underspends within the overall budget. The main driver for the total overspend is due to the Children and Families budget projecting a £4.275 million overspend. This is mainly due to residential placements and child respite overspends at period 9. The service are currently doing a service review in this area. Additional funding from Inverclyde Council as part of the budget process will help with this review into 2025-26. We also have the use of the non-recurrent pension money to assist with the smoothing of the Children and Families budget, and we plan to use this to help us with this budget for this year. This is also partially offset by underspend in the older person assessment and care and management underspends. If this overspend remains at year end, the use of smoothing reserves will be used to bring this position back to break even. The next section highlights HSCP's progress to date with the achievement of its in-year agreed savings. As you can see at section 3.2.11, we've already made good progress in the delivery of our savings. Moving on to capital, section 4 shows the current capital position. At this point, we're not showing significant spend to date. This is likely to be incurred next year, especially with our bigger projects like the Community Hub Capital Project. Appendix 5 shows our overall earmarked reserves position, and it shows we started the year with 19.287 million and we expect to finish the year with 13.575 million based on our current projections. Obviously this changes as we move through the year. That's the main updates from myself, and happy to take any questions anyone might have.
Okay, thanks very much, Craig. Just opening up now for questions and comments. Councillor McCabe.
Thanks, Chair. Just ask around this, I suppose the projection of 111,000 over spend for the year. That's obviously a reasonable reduction since the last report. But trying to link that into the savings progress identified in paragraph 3.211, where he's saying currently £269,000 of savings are still to be achieved. Is there an assumption that those 269,000 savings will be achieved by the end of the year, and is that reflected in the 111 figure, or are you expecting to have a shortfall in terms of the savings?
Thanks very much. Over to you, Craig.
Yeah, happy to come in. It does reflect the current position of where we are at the moment. We are expecting, as part of the overall budget process, we're looking for a few of the areas for this financial year to have a shortfall. However, we're building that into the budget for next financial year. Overall, we were showing 111. That does show the significant savings that we've made this year. We do expect the vast majority of what we put there to be recovered. I think some of them, the main ones that I can think there, are a few of the areas of perhaps in the commissioning side, and I think some of the packages of care. But we have seen we've seen underspends within some of our other areas, which has kind of brought us into the 111 position. But we are factoring that into our budget that we're setting for next year. And one of the areas we will be looking is any under recovery or savings that we've not achieved. We're going to bring forward another proposal as part of the budget that's going to come to IJB very soon.
And just to follow that up, Chair, in terms of the budget, so I'm presuming it's a 1 year budget, building on the 2 year budget approved last year or this year.
Through yourself, Chair, that's correct. The budget we're bringing forward is similar in line to what Inverclyde Council have done. We're proposing a 25-26 budget only, and it's going to be just an update from the 2 year budget that we set in March there, which is in similar position with what the Council have done.
Thank you.
Okay, thanks very much, Councillor McCabe. I don't see any other questions or comments in the room or online, so are we happy to note the current positions in that report? Thanks very much. Thanks, Craig. That takes us on to item number 3, which is a report about the HSCP Collaborative Care Home Support Team. And I think Alan's going to introduce that for us. Thanks, Alan.
Thank you, Chair. Yeah, the purpose of this paper is to advise and provide assurance to the Scrutiny panel of the work that is overseen for the local collaborative care home support team, including the significant areas of improvement and good practice. As you know, that we regularly bring to the Scrutiny panel governance reports and inspection reports. This paper gives a deeper dive into the work that's done around how the multidisciplinary teams and our partners in the sector helps provide a very important support to a very important part of our community. At the end of the COVID period, December 22, new arrangements for NHS boards and local authorities in providing enhanced clinical and care support for care homes was put in place, with the provision of enhanced collaborative clinical and care support for social care in Scotland. This builds on current practice to strengthen collaborative cross-sector support to care homes. A number of recommendations were developed with the overall focus of continued enhanced support for adult and older people's care homes. We recognise there was already very good support within the care home sector. This was an adjunct and a support to the ongoing work and how it's developed in the future. The recommendations support a partnership approach which recognises the experience of care home staff and the provision of support to care homes in the context of ensuring a homely environment in which people live and work. The framework recommends that the health and social care professionals continue to work together to identify ways to improve the health and well-being of people who live in care homes, as described by the My Health, My Care, My Home healthcare framework for adults who reside within a care home. Inverclyde HSCP has a very strong collaborative care home support network which meets weekly with a multidisciplinary membership, including community nursing, the professional chief nurse, commissioning, social work, mental health, chief social work officer, care at home, and the care inspectorate. This meeting updates on areas of concern, work related to the implementation of the healthcare framework, national and local care home meetings, policy updates, care inspectorate feedback, and discussion around adult support protection concerns. In November 2024, NHS Glasgow and Clyde were asked by the Scottish Government, alongside all boards across Scotland, to complete an evidence of impact return in order to provide evidence of the collaborative care home support across Inverclyde. And this looked into assurance that the board is providing good leadership, support and guidance within care homes, additional support provided to care home residents, families and staff, assurance that teams are both working collaboratively within the care homes and meeting the needs of care home residents and staff and carers. It also looked at the actual impact of the multidisciplinary teams that were involved in this piece of work, and any learning and development of this work and ongoing evidence for view sharing nationally. The evidence impact document for Inverclyde provided a good overarching picture of the work that is overseen by the local collaborative care home support team, including significant areas of improvement and good practice. Inverclyde HSCP carried over and above our normal commissioning and governance processes. Inverclyde HSCP carries out an annual care home assurance tool visit to all Inverclyde care homes for older adults, and including adult mental health care homes, of which Inverclyde is 17 in total. Within the report, some areas to note as the great work that's been done around stress and distress training in terms of supporting people with dementia and how staff get a better understanding of the needs and the support for people with dementia. Paul, before you convey where the care homes have been supporting and reducing the number of people that are admitted to hospital at that part of their life when they're passing away, and when it's inappropriate that somebody goes to a hospital environment, and it's better for them to pass away within their own home, supported appropriately. And there's been a great deal of work done that locally in a multidisciplinary way, also including the palliative care team at the hospice. And that's been a very good success in terms of making sure that individuals are treated with dignity and respect and are supported in their own home at a time of passing. A lot of good success around urinary tract infections, which again is another issue that people are having to visit the hospital unnecessarily for. Whilst there's very good care from the hospital, that whole process of being admitted can be disturbing, distressing, and in some cases unnecessarily. Work around the false pathway as well, whereas trying to minimise the number of folk who have ongoing issues with falling into care home. That is again has been a success locally for Inverclyde. The Scrutiny Board is asked to note the evidence that's been collated and contributed to the Scottish Government evidence of impact return. The evidence demonstrates improvements in good practice in Inverclyde care homes, which has been supported by the local collaborative care home support multidisciplinary team and care home collaborative. That's everybody that's involved in care within the care home, the HSCP, the homes themselves, carers, and other organisations as well. It's bringing everything together to support a very important part of the community. Happy to take any questions.
Thanks very much, Alan. Thanks for that report as well. I think it's really good for the panel to get that sense of that collaborative work that's going on there. So no, that was a really useful report for us. Councillor Brooks.
Yeah, thanks very much. And I was going to say myself, it is a very helpful report. It's nice to see the value and the input. My question is maybe to the extent of, so we've got great lessons learned here for this report, and obviously going to the Scottish Government. I understand all that reasons why the care home support team. I wonder, lesson learned from those people at home. Can our teams who actually are supporting people who are in their own homes, can we obviously get this information to them to ensure that good lesson learned for the care home support team is just also used for everyone?
Yeah, I mean, whilst this area is focusing around individuals that have been supported within a care home environment, there's lots of good learning that can be passed across the whole care sector, even in terms of the multidisciplinary working and the value of that, and the sharing of development knowledges, and also where things don't go quite right, we're taking the learning from that and implement that in any form of care. So whilst this is focused around one area of support, there's the multidisciplinary nature of this. We're all involved in multiple bits of care, so you can take the learning across all avenues.
Thanks.
Thank you.
Yeah, thanks for that question, Councillor Brooks. And do you think, just to follow up on that, do you think we've got the structures we need to in place to make sure that learning does follow through the different settings?
As with everything, every day is a school day. So whilst I would say we've got a very, very strong network and very much is interdependent on the work of the commissioning team, as we always look to develop things, there's always we can always take it to the next level. Let's make sure that level's built on a strong foundation. So yes, there will be opportunities to develop that.
Okay, thanks very much. Thank you. Councillor Armstrong.
Thanks, convener. Yes, you know, I want to echo, you know, the report's very much welcomed. It's there's a lot of very interesting information in it. There are also a lot of short forms, and I just had one question on one of them. I think the AP ones are adult protection referrals, but I don't think there's anywhere in there that makes that clear. One, so I suppose my question is, one, am I right? And secondly, but I suppose about that sentence, it says, as a result of numerous AP1s. Does that mean numerous as in locally or numerous as in nationally? I just would like a bit more an explanation about that. Thanks very much.
I'll maybe come in to answer that. Maybe I might bring Jonathan in as well, but more around the actual kind of the governance around adult support protection.
Yeah.
This is obviously quite a high level report, and obviously there's other ways that we're reporting on adult protection. So this probably report doesn't go into that depth, but you're quite correct. And in terms of the actual meeting itself, we're looking at as a strategic themes around the AP ones. We're not going into individual cases as such. It's more about themes that we can then take a bit. Is there a particular issue in this care home in a certain area? But obviously underpinning all that is the adult support and protection processes, which I would very much, I'll maybe pass over to Jonathan to see if you get any comment on that. Jonathan does also, as Chief Social Worker, attend the meeting.
Thank you.
Thank you very much, Louise. Alan, yourself, Chair, absolutely the AP one is about those initial concerns, Councillor Armstrong, that are then subject to scrutiny and potential investigation. And I think one of the, I suppose this work for me is building on some of the really good practices, some of the learning that we took through the impact of the pandemic initially, and how we brought so many different professional groups together in terms of being able to ensure that our most vulnerable residents were adequately supported and protected. But I think in terms of the reference you make to the report around stress and distress training, that has enabled that sharper focus locally and nationally, I suppose, about the confidence of our colleagues in residential settings to be able to navigate the landscape of adult protection concerns, but also where there is stress or distress due to dementia or any other underlying conditions, to be able to make that differential and make sure that the input and the response to that is appropriate.
Thanks very much. Thank you.
Thanks very much. Thanks for those responses. I think, yeah, the only other question I had was just around, like, we've got some of the actual projects that had happened, but just were there any sort of developments coming through of different ways of working that have come out of this more sort of collegiate approach? But I think you've sort of started to answer some of that in response to Councillor Armstrong's questions. You know, that's great, and I'm not seeing. Sorry, Councillor McCabe.
Thanks, Chair. It's a very helpful report. It obviously gives us reassurance that this work is paying dividends and these real sort of practical issues are being addressed for the benefit of residents within the care homes. But I suppose my question is more sort of wider in terms of the stability of the care home sector. Are we sort of seeing a stable sector in Inverclyde, or are we still facing challenges around financial stability, being able to attract staff and etc. to properly staff care homes?
Thank you. I'll maybe start off, and I'll maybe bring again Arlene into this in terms of the wider contractual side. What we are getting here is we're getting a very good bit of intelligence on a weekly basis over all our care homes within the Inverclyde area, and they are brag rated in terms of red, amber, green. So we report that back on a weekly basis, and all that's collated in terms of what the kind of positions, not only in Inverclyde but also across the whole area. So it gives us a feel for maybe potential trends. Over the last few years from this has been going, there has been a couple of our care homes where we have picked up a trend in a certain area and which has been repeated, so that we've been able to then focus more into that particular care home area. I think we're very fortunate in Inverclyde. I think we have got quite a good strong care home community, and we also meet with the care homes themselves as a collective through their care home managers. But we certainly do have a very good eye on the sort of strategic position of our care homes. In terms of the financial side of the sector, obviously that through their governance meetings, that is something that in conjunction with our finance colleagues we do keep a regular check on. But maybe pass over to Arlene and that's I wouldn't do it justice. I think Arlene's to give a better idea.
Yeah, so as Alan's saying, we do our governance every 6 months with our care homes. So at that governance meeting, we have a discussion in relation to staffing. We also discuss any financial issues that they've got. At this point, we always get the accounts in as well every year, and our finance team check all the accounts. So at this point, we've not got anybody who's saying that financially unstable within the care home market. In relation to staff's always going to be really difficult to recruitment and retention throughout the care sector is very difficult. However, again, we're not getting anybody coming in to say there's been one care home that has had to use agency staff while they're recruiting nursing. So that has been a wee bit difficult, but they always inform us. So there's significant incidents that they need to report to us if they are short of staff, but there's not any care home within Inverclyde at this point that's saying that they are short-staffed, that they aren't able to run with their, they've got to do like a dependency tool, so they're all managing within that dependency tool for the
Okay,
staffing levels.
that's helpful to know, thank you.
Thanks very much. Yeah, thanks for that question also, because obviously that stability underpins everything we're looking at to do with the care homes at the moment. So, just checking. There's no more questions or comments, so thanks very much. And we're just happy as a panel to note the contents of the report. Okay, and thanks very much for bringing that to us, Alan and Arlene. So that takes us on to item number 5, which is the joint No, it doesn't. Apologies. It takes us on to item number 4, which is inspection of children's residential houses, and Jonathan's going to talk to us about the view. Yes, thanks, Jonathan.
Thank you very much, Chair. Through you. This is a brief update report as part of the Care Inspectorate's regular cycle of inspection of regulated services across Scotland, and that includes the inspection of residential children's services. So for Inverclyde, we have 3 children's houses that are inspected approximately every 2 years in line with that national programme of activity. And the View Children's House in Greenock, along with our other houses, Kylemore and Cross Hill, were last inspected in 2023. However, in January of this year, the Care Inspectorate commenced their latest round of the inspections, and the first house to be inspected locally was the View. The inspection methodology used is focused around a key question, which is how well we support children and young people's rights and well-being. And within this, within the context of the inspection framework, the house was evaluated against a particular quality indicator, which looks at how children and young people feel safe, loved, and get the most out of life. And that very much echoes the language and the spirit of the promise. Within the report, I made reference to the 6-point evaluation scale that the Care Inspectorate used, from unsatisfactory at grade 1 to grade 6, which is excellent. And I'm really pleased that the View has been evaluated at 5, very good. So that's a move from grade 4 2 years ago. Within the inspection process, inspectors met with a number of young people. They also met with family members and staff and reviewed a number of key documents as part of that process. And within the inspection report itself, key messages included recognising the commitment of the staff team and their ability to build genuine and trusting relationships with young people. There is a quote from one young person who describes the View as like a family here, and young people were also able to access independent advocacy and to take part in their care and support. One of the elements that we've been working on over the last couple of years has been to enhance access to mental health and emotional wellbeing supports, and again the inspection team noted the positive impact of that, as well as other indicators of positive outcomes, particularly that all young people who live at the View are involved in education and many also have part-time employment. The inspection team also were aware of our local commitment, our very strong commitment to continuing care to support young people in residential settings away from home into adulthood, and they suggested that that could be strengthened by a specific policy So that has been taken on as a particular action. But there was only one recommendation made by the inspection team, and that referred to a staffing needs assessment to be developed to better evidence the staff skills and staff development, as well as formalising the assessment of staffing arrangements. So work started on that during the time of the inspection, and that has since been completed. The improvement plan is included as an appendix to the report, and it does make reference to the development of that specific continuing care policy. The inspectors did comment that young people are benefiting from a range of opportunities, and that included holidays, days out, and also that it was really clear that there was that sense of fun and laughter, and I was really pleased to see that noted and highlighted specifically within the report itself, and how that contributes to a welcoming, relaxed and homely atmosphere for our children to live in. So in conclusion, the work within the action plan is well underway, and those actions will be completed within timescales. We do expect that the reports for Kylemore and Cross Hill will be published imminently, and it will be my intention to bring a summary report on those children's houses and any actions arising from those to the next meeting of this panel. Chair, but happy to take any questions.
Thanks very much, Jonathan. So really pleased, I'm sure we all are, to see this rating of good, and just our thanks very much to the young people and to the staff for their role in the inspection. And that's really good to hear that one of the recommendations is moving on, and that everything in the action plan should be completed by June, which isn't too far off. So no, thanks very much to everybody for that. Councillor Jackson, I'll
Yeah,
your question, comment.
not so much a question, just a comment, as I've said before. Very much welcome the report. Within my day job, as I've said to you before, Jonathan, I'm very fortunate I get to get into these care homes, the view in Cross Hill and Kilmore, and see what goes on, and I see the relationships between the staff and the children. That's in there without my counsellor that on, so I just get inconspicuous and kind of get on with what I do. And I get to speak to a lot of the staff, and I speak to the kids, and I see the interaction between them. I see the trust and the care that's given, and it's heartwarming. So it is, and you see a lot of these young children are now confident, they're safe within that environment, and it's a lot of times, it's a very calming atmosphere. It's not at all stress related. So I'm just saying, I'm fortunate I get to get in there and see this report as it happens, and it's just to thank you for that report, and all the team and everybody that works within these places. They're doing a grand job.
Yeah, thanks very much for that, Colin. Councillor McCabe.
Yeah, thanks, Chair. I mean, it is a very positive report, and I absolutely would commend the service and the staff for the good work they're doing. And obviously, we're on an improvement journey, going from good to very good. There is that excellent up there. Obviously, we always aim for and strive for. So would you be confident, I suppose, if we can maintain the current standards of service and build on the actions that are in the action plan that we could get to the excellent rating? I think we have had excellent ratings in the past, but some of our care homes.
Through you, Chair, it would be wonderful to see that recognition, Councillor McCabe, to achieve an excellent. I know that 2 years ago, whenever the houses were last inspected, there was a different inspection methodology for residential children's services, and that is reflected, I suppose, in the grades that are assigned to residential services across Scotland. So I think it's quite difficult to compare the current inspection regime with what may have existed 5, 6, 7 years ago. But it's always good to have something to aim for. It's fair to say, but I think and I'm really grateful for your comments, and Councillor Jackson's as well. And I'll be sure to pass that on to the team and to the young people too. I suppose it's always unusual to live somewhere where you're inspected, or you have inspectors come into where you live, and I think it's absolutely to the credit of our young people that they have navigated that and continue to navigate that really well. But for the staff team, a really good achievement to go from good to very good, but always nice to have something that's taken for.
Thank you.
Okay, thanks very much. So I think as a panel we look forward to hearing, as you said, quite soon about Kylemore and Cross Hill, and hopeful that we'll see the same, or if not better. But thanks very much to everyone involved in that, and it just remains to note the report. Thank you. And we are this time actually on item number 5, which is an update on the joint inspection and adult services that we had back in October 2023 to March 2024. So I think I'm handing over to Jonathan to take us through this. Thanks, Jonathan.
Thank you, Chair, and through you, absolutely, this is the latest update on work following that strategic inspection of adult services, and that particular inspection was undertaken by the Care Inspectorate and Healthcare Improvement Scotland, and their focus was very much about integration and outcomes, with a particular focus on people living with mental illness and their carers. This was a strategic inspection, which means that it was structured around looking at how effectively the Health and Social Care Partnership works together strategically and operationally, and the inspectorate language was very much focused around how services are delivered seamlessly and how that impacts on improving health and wellbeing outcomes for adults. The improvement plan that we developed following that inspection was submitted to the Care Inspectorate and accepted by them, and that has continued to be progressed over recent months, and a detailed update was provided within the appendix to the report. The theme of that improvement activity is across a number of different areas, particularly developing outcome measures which have been informed by the users of services and their carers, also how the needs of unpaid carers are identified, as well as effective arrangements for teams to work in a more integrated way, and looking at co-location opportunities as well. There is a focus too on developing the confidence of our staff around the use and uptake of self-directed supports to be able to maximise choice and control for people. And there was also a specific area of work around strengthening social work governance, including those statutory functions for mental health officers as well. All actions have been assigned a red, amber, or green rating, and the majority of actions have been completed or are on target to be completed within timescales. More specifically, audit activity and improved methods to capture qualitative and quantitative data has been progressed, and work is ongoing to strengthen how that's reported to the Care Strategy Board. Rose Trainer is our service manager for mental health social work and joins us today, but Rose's post was one of those further actions to strengthen social work governance around mental health, and delighted that Rose has joined the partnership within the last 3 months, and that really has provided a stronger balance of professional leadership across mental health services. The improvement plan also references work to improve how we capture the views of users of services and carers, and that has involved increasing the local awareness of care opinion, and also working with our third sector partners at Your Voice, and engaging more strongly with service user forums, and also looking at how our assessments could be improved to increase the focus on carers' roles and their needs as well. The reference to seamless services has been best reflected, I suppose, within the partnership around one of our areas of redesign, which isn't so specific to mental health services, but across adult services in its entirety, and looking at the development of a model of a single integrated front door. And managers are continuing to progress that, and that's really about trying to simplify how people can access our services, and also to ensure that they really only need to tell their story once and don't fall into the cycle of having to tell their story to different parts of the organisation. And it's very much about integrating those services and how that can link to our bespoke mental health services as well. There's some outcome-focused assessment and planning guidance that's being developed and reviewed as part of the wider review of mental health social work services, and also those robust governance processes are continuing to be adhered to, and within the specific progress around this action plan, that continues to be reported on an ongoing basis to the Health and Social Care Partnerships and Care Governance Group, and also to the IGB Audit Committee. But I'm certainly happy, Chair, for any questions, and I may call on Rose to assist me with them, particularly operational, but happy to take any questions.
Thanks very much, Jonathan. And welcome to yourself, Rose, and I should have also said at the beginning, welcome to Margaret as well, to this committee too. Yeah, so am I right in thinking, Jonathan, that this was one of the first inspections of this new model, is that right?
You're absolutely right, Chair. We were the first area to be inspected using the particular focus on adults with mental illness, as it was described during inspection team.
Okay, so it was great to get this update and see lots of greens in it, and then, as you said, the ambers that we're seeing are about the integrated front door and a bit of awareness and confidence building around self-directed support. So I think before I move out to the rest of the panel, I think my questions were just about the pace of the progress we're making on that and how sort of happy and confident we feel about that, because it looks like a lot of work has already been done, but as you say, still a few things still to be working on. Thanks, Jonathan.
Thank you, Chair. And through you, absolutely. The range of improvement activity was quite broad, and I think from the initial publication of the inspection report, and as you rightly say, we were the first partnership area to be inspected within this particular focus. It was incumbent on us to try and really translate those areas of learning into an accessible and smart action plans. So really encouraged by the progress that's been made. I think there's always a risk with any improvement plan that we set ourselves ambitious timescales that are often not realistically achievable, but I think that the iteration of the action plan that's before panel members today reflects, as you say, the work that's been done. I think areas like self-directed support can be complex, not just in terms of being able to develop the competence of the workforce and the different options available, but also taking our communities on that journey with us as well, and feeling confident both in the availability of different arrangements where they can have that sense of control, but also the availability of different services to meet the needs of individuals and their carers as well. So that work is ongoing, as you rightly say, Chair, but I'm confident as Chief Social Work Officer that the work is progressing at a suitable pace, and the review of the mental health service that Rose is leading on since coming into post will further contribute to that.
Okay, thanks very much. I think that move towards like tell us once has been mentioned and been around for a while, so I think seeing progress on that would be really meaningful for the people accessing these services. Councillor McCabe.
Yeah, I should have perhaps declared an interest as an unpaid carer of a young adult with a mental health condition. I mean, it's good to hear about how we're trying to, I suppose, engage with service users and their carers to understand better their needs, and using sort of, I suppose, representative forums to do that. But how do we ensure that every single service user and every single carer's needs are met on a sort of individual basis? What mechanisms to be put in place for that?
To yourself, Chair. Thank you, Councillor McCabe. The revised assessment processes are one critical aspect of that. So making sure that not just the views and the wishes of the individual, but their care, whether unpaid or paid, are reflected in that. And certainly within the inspection process, we were very aware of the huge importance on an individual level, but also to our communities about the role of unpaid carers and their needs and their criticality in terms of the plan around adults with mental illness. So the revised assessment's been really important, and it does build on the relational practice focus, I suppose, that we're really committed to in the partnership as well, about building that relationship and that confidence with carers, as well as the individuals in receipt of support services as well. So that is really important. It's also about how we can ensure that we're capturing those views in a variety of different ways, and the use of digital, the use of technology to be able to provide opportunities to gather those views and that feedback on a continuous basis as well. So that is something that certainly we're keen to continue to develop, not just around self-directed support, but that whole person-centred assessment as well.
And how regular would those assessments be carried out?
I might turn to Rose for that, just in terms of how frequently assessments are reviewed. Certainly the individual needs of the there would be part of that review process, but with your indulgence, Chair, I'll pass over to Rose just to provide a bit more information.
Okay, so in terms of the carers assessment, what we've set up within the community mental health team is that we have linked in with Unity, which provides our carer support, and we have a direct referral system to them, so we're very aware of what's coming from mental health. On the back of this, in order for the care providers to be able to support carers, young carers, we're also engaging in a programme of training with them for them to understand what it means to be a carer for somebody that experiences severe and enduring mental health. We're also looking at we have a programme on the back of that of how we work with the carers themselves to understand severe and enduring mental health, what this means, what's normal, what's not, what's people becoming unwell, so they can also have a good understanding of what it's like and how you support someone, but with that, looking after themselves as well. At the moment, we've just started a very proactive, when somebody's coming in, outreach. So when somebody comes in, we ask them, do they have a carer? We are proactive in making a referral to the carer centre. We're also encompassing in that guardians under the Adult Incapacity Act, because they're also carers as well. So we have QR codes within letters that we send out where they can be link in with the care centre should they want to do that as well. So that's in terms of what we're doing right now.
Okay, that's helpful. Thank you.
Thanks very much, and thanks for that, Rose. That's really good to get that information and input. That's great. Thanks very much. So nothing else online or in the room. So you're very welcome to stay in that chair. Just for the panel to know the progress within the improvement plan. Thank you.